Hello, this is Mrondo Rogers, a pharmacist and a clinical instructor. Today's session is going to be about hypertension. So to begin with, hypertension is a persistently elevated blood pressure that is above 140 out of 90 millimeters of mercury. Whereas blood pressure is the force that circulating blood exerts on the walls of blood vessels, especially the arteries. Now, when you look at blood pressure is always written as a fraction. We have the numerator, which is the systolic blood pressure, the denominator, the diastolic blood pressure. Then systolic blood pressure is the pressure exerted on the walls of arteries when the heart is pumping out blood. Diastolic blood pressure is the pressure exerted on the walls of arteries when the heart is relaxing. Pathophysiology, blood pressure is a product of cardiac output times total peripheral resistance. Cardiac output is a product of stroke volume times heart rate. When you put the two equations together, blood pressure becomes stroke volume times heart rate times total peripheral resistance. From the equation above, any factor that increases any of the above parameter will increase your blood pressure. So moving on, we have two types of hypertension. We have essential hypertension stroke primary hypertension. So the definition, essential hypertension is a type of hypertension whose cause is not known. This type of hypertension accounts for about 90 to 95% of the cases, and it is not curable. It can only be controlled using drugs and non-pharmacological management. Secondary hypertension, this is a type of hypertension whose cause is known or can be singled out. So this type of hypertension accounts for 5 to 10% of the cases and is curable once the primary cause is managed. So these are some of the causes of secondary hypertension. 1, renal stroke kidney related. So under that subtopic, highlight number 1 is you have the chronic kidney disease, renal artery stenosis and glomerulonephritis. The other one is polycystic kidney disease. Then number 2 is we have endocrine diseases. Under that subtopic is we have primary aldosteronism, also known as Conn's syndrome. Now, primary aldosteronism is where there is excessive production of aldosterone from adrenal gland. So this aldosterone will lead to increased sodium deabsorption that will in turn leads to increase in blood volume. Then we have pheochromocytoma, which is another disorder of adrenal gland. So this disorder will lead to excessive production of noradrenaline and adrenaline, still from the adrenal gland. Then another condition is Cushing's syndrome, which is another disorder of adrenal gland that will lead to excessive production of cortisol. So this cortisol will cause increased reabsorption of sodium chloride as well. Then another disorder is the thyroidism. Thyroidism will also increase your blood pressure. Thyroidism is a condition where your thyroid gland produces a lot of thyroxine hormone. So that will also increase your blood pressure. So number 3 is vascular causes. One of them is coarctation of aorta. The other one is vasculitis. So moving on, number 4 is we have drug-induced. We have certain drugs that can increase your blood pressure. One of them is NSAIDs. The other one is oral contraceptives. Another one is corticosteroids. Then the decongestants and the antidepressants like the tricyclic antidepressants and monoaminoxidase inhibitors. So moving on, we have risk factors to hypertension. One is we have the non-modifiable risk factors. Number 1 risk factor is we have age. Age will increase your blood pressure by causing a progressive arteriosclerosis, or it will reduce your baroreceptor sensitivity. So this age-related hypertension is normally isolated systolic hypertension. Gender is also another risk factors where the risk of hypertension in males are higher before 55 years and then higher in females after menopause. The other risk factor is genetics or family history. So this, if you have first degree relatives having hypertension, you are also at a risk of getting hypertension. Another risk factor is ethnicity and race can also put you at a higher risk of getting hypertension. Then we have modifiable risk factors. The modifiable one, these are risk factors which can be modified through lifestyle changes. So one of the risk factor, the modifiable one, is diet. So these are the things under diet which can put you at a higher risk of getting hypertension. One of them is high salt intake, consuming a lot of saturated fats, consuming foods that are having low potassium levels. The other one is weight. If you are overweight or if you are obese, then you are most likely to have hypertension. The other one is physical activity or sedentary lifestyle also put you at a risk of hypertension. Another one is alcohol consumption. Another one, tobacco smoking, psychological stress, diabetes mellitus type 2. Then lastly, drugs. Clinical presentation. Usually hypertension has no symptoms, hence the name silent killer. But if symptoms are there, these are the symptoms: headache, blood vision, palpitation, nose bleeding, buzzing in the ears. Moving on, we have complication of hypertension. One of them is myocardial infarction, which is the death of heart muscles. The other one is cerebrovascular stroke. Another one is atherosclerosis, that is formation of plaques in coronary artery. Another one is hypertensive encephalopathy. Another one is aortic aneurysm. And lastly, chronic kidney disease. So that is all for today. So I ask you to please subscribe to my page or to subscribe to my channel for more informative videos. Thank you for listening in.